patient experience, one of my favorite topics to cover, and I am very excited for my next guest. It's someone I've wanted to have on the program for a long time, and she's finally able to make it happen. I'm about to sit down with Laura Cooley, and she is the editor-in-chief of the Journal of Patient Experience. I've long admired what Laura is doing. I think the journal is fantastic. You're going to learn all about it, and I can't wait for you to hear her answer to what she's excited about in terms of technology and process when it comes to patient experience. Let's get to it. Swaay.Health. Laura, welcome to the program.
Thank you.
It's always a pleasure to see you. This
Likewise.
is a different context for me seeing you because we normally catch up at the Patient Experience Conference, right? Elevate and others. But I'm very curious to get your take on what the latest in patient experience is. But before we get there, for the benefit of our audience, Laura, can you please just introduce yourself and tell us a little bit about what you do?
So I'm Laura Cooley. I serve right now as the editor-in-chief of the Journal of Patient Experience. So if you haven't heard of that, it's an academic journal. We publish mostly research, also patient, family, and caregiver perspectives and industry insights. But it's open access, so anybody can read it. But what's important to me about that is that we're trying to move science into the patient experience domain. That patient experience is also more than a metric. And for me, that's really what I'm talking about most in my work today when I'm advising with healthcare clients, is that we have to think about it more than just a survey. And it's not about making people happy. And there are proven evidence-based behaviors we can put into practice that help make this possible.
I love the journal. I love that it's open, first of all. I read it. And I love that you are applying that science because for a long time, as you know, patient experience was seen as this sort of fuzzy, feel-good kind of operation.
Yeah.
But you're putting the real hard science to say, listen, this makes a difference.
Yeah. I think if we look at the science behind it, we can see that patient experience is not just about soft stuff, like communicating and being nice. Like empathy has been a big part of the conversation with patient experience, but I like to look at empathy as a tool to the outcomes that we want and need to deliver to our patients. So I recently reviewed a systematic study of about 450 research papers that looked at empathy. And in all of them, there was some kind of outcome showing significance with a clinical domain or a financial metric or something that's hard stuff, not just soft stuff. And I think that those outcomes really matter, and when we connect the dots, we can really start to impact what matters to patients and families.
Well, man, your work at the journal and all the other stuff you do really helps, to me, convince executives to invest in this area, which is so needed.
Yeah, and it can be challenging to make the case, to show the real ROI. So I often work with people to step back and say, okay, what are all the data that you have? How does that connect to your patient experience data? And how can we tell a story that is appropriately convincing to make sure this is an investment that we keep leaning into? And I think in the constraints that we're operating under, lots of things are at risk, and patient experience could be at the wayside if we don't put enough evidence behind it.
So Laura, given your unique position in the marketplace and how you are really at the hub of a lot of things happening around patient experience, what are you seeing that's got you excited in this patient experience realm?
Well, today we're having lots of conversations around us regarding technology, digital innovation, artificial intelligence, and I think what I'm excited about is that if we leverage artificial intelligence and all our other innovations to keep the human connection at the center, I think patient experience can benefit in an extreme way. And we're already seeing patients take AI into their own hands and think about how it can help them have better outcomes and feel a sense of agency. There are all sorts of conversations about the worry and risks and whatever, but this is moving. And I've been talking to lots of people about how we can also redefine AI as continuing to have authentic interaction. And so that's a frame I'm using, sort of a relational compass, to make sure that authentic interaction and artificial intelligence create like this double AI experience that leads to outcomes that everybody wants.
Laura, I really like that reframe there, because I think there is a fear that AI will make healthcare a little more dispassionate, even though ironically it can help craft better messages, be more personable, but we kind of know when we're dealing with an AI.
Yeah.
But what I'm hearing you say is you're trying to push to make sure that that AI is deployed in the right way, that it engages patients, give them more agency, as you put it.
Yeah. I think if we could ask people who are designing and selling AI solutions, the people who are buying, adopting, integrating AI solutions, to pause and think, like, how does this hurt or harm an authentic interaction? Then that could really take us a long way. Like, is it attending to the needs of the patient? Is it aligning with shared goals and shared needs? Like, is it adaptive to the individual in a personalized way? So I think those are the kind of guiding questions I'm hoping for.
Laura, I won't ask you to name any individual companies, but is there a technology related to AI or not that you're excited about for patient experience?
I mean, we've been talking about ambient listening and AI scribes, and I continue to be excited about that because not everybody's adopted it yet, and the people who have are still somewhat early adopters. So I think we have an opportunity to refine the design and implementation of our ambient tools to program in frames that will keep humans in the conversation so that it can capture the emotional story and the social context of what's happening with our patients and families, and also like prompt our clinicians to be sure they are attending to the human side and the evidence-based practices that we know improve communication outcomes.
Now, Laura, we are here at HIMSS 26, here in lovely Las Vegas, and you hosted the entire day yesterday and had a session this morning. Can you tell us a little bit more about that?
Yesterday's Smart Transformation Forum was really interesting because many of the speakers were highlighting opportunities for deepening human relationship and connection, challenging the audience to think about how we can leverage digital innovation to enable the relationship. And everybody's been talking like ambient scribes, free up time for clinicians and help them focus on the patient. Well, that's only going to be truly deepening the relationship if we also like create the context and space for it and make sure our clinicians are still getting equipped with the human skills they need to be successful in that domain.
Yeah, I'm going to hear you, because although scribes takes the doctor and the clinicians away from the screen, that doesn't necessarily automatically translate into more engagement with the patient. There's still some work that needs to be done there.
Yeah, and just because we're freeing up time, it doesn't mean that time is necessarily getting dumped back into the patient relationship. And so I think we have to protect that as people who care about patient experience and patient engagement. The thing I was most excited about in my session today was the opportunity to share some research and actually do some interactive exercises on how we can focus on what matters to patients and families and translate that into our conversations about what matters to hospitals, what matters to executive leaders, what matters to payers, what matters to providers, and like connect the dots, because there is a lot of shared what matters. We just have to like change the narrative to make sure patient experience gets put closer to the front.
Laura, can you give us a sneak peek at some of the exciting things you're working on at the journal?
The journal is actually publishing a lot of articles. We're leaning into some particular collections over the months ahead that we want to emphasize and create calls for papers. One is our collection on digital innovation and technology and the patient experience, and we're revitalizing that collection right now to make sure it's staying current, so I'm excited about that. And the way the journal works is that we don't write articles, we publish other people's writing. So for people who have work that they're wanting to share, whether it's research or an evidence-based perspective or something else, it gives us space for that. And then the second collection I'm really excited about is that we have a collection on value-based care. So making sure that value-based care stays authentic to what it was supposed to be, which is the relationship between outcomes, finances, and the experiences that matter to patients most.
Wow, covering a lot of stuff at the journal.
That's right.
Well, final question for you, Laura. Where can people go to see the journal?
Okay, so you can go several places. One place is journalpatientexperience.org. You can find me at lauracooleyphd.com, and I'll help you find all of it.
And you will. I know you're very responsive. Well, Laura, thank you so much for taking time out of your busy hymn schedule to be with us today. Really appreciate it.
Thanks. Thanks for taking time with me.
Hey, I really want to thank Laura for taking time out of her busy HIMSS 26 schedule to spend time with us on camera. I really enjoyed our conversation. I was particularly interested in her comments around, we need to be more purposeful with AI, and how she's excited about AI scribes, but how just deploying it does not automatically equate to a better patient experience. We still need to do more work to educate clinicians, give them the tools to be more engaging. And I'm kind of hopeful for what she's describing as the next wave of publications that she's doing at the Journal of Patient Experience. I'm looking forward to that, and we'll put a link to the journal, of course, below. Hey, if you made it this far in the video, we would really appreciate it if you mash that like button and click subscribe. Also, head on over to Swaay.Health, that's Swaay with 2 A's, .health, where you will find more great content like this. I'm Colin Hung, thanks for watching, and I'll catch you on the next video.